Healthcare evolution leads to emergence of precision medicine, a tailored medical approach for disease prevention and treatment that considers people's individual variations in genes, environment, and lifestyle. However, for health technology assessment researchers, dealing with precision medicine can be challenging. A standard reference case is needed to evaluate precision medicine's value. This leads to a workshop with experts from Singapore and Thailand with a goal to develop a standard precision medicine reference case.
Precision medicine is about giving people choices based on what we know of that person on an individual level so that they can make their own choice that's to the best of their benefit.
In the past, it either took us a very long time or a lot of resources to come to the diagnosis, or we do not even know the diagnosis. But with precision medicine, it can be a very powerful diagnostic tool for us to diagnose patients. And with this diagnosis, we actually can do a lot. Besides giving treatment-specific, disease-specific treatment, it also allows us to counsel the patients with regards to the disease prognosis, give more appropriate treatment, as well as for family members.
So it's delivering the right medication to the right group of people. I think recently it's been gaining a lot of attention because of better education in the public, as well as also in the healthcare profession.
So I think the policymakers are not familiar with precision medicine. They think that it's going to open up a can of worms because the possibilities are endless. They are also mindful that the industry is developing high-cost treatments specifically for a small group of patients, and they feel that it might bust the healthcare budget. So they are therefore a bit apprehensive about reimbursing for precision medicine, both the technologies as well as the treatment.
There are always challenges because it takes a lot of effort, not just on an individual level, but on a systems-wide level. Everything has to change. So precision medicine is also a humongous effort, and it's the same kind of challenges for any kind of big change.
Reference cases is that they're a little bit like clinical guidelines, but for medical technologies rather than for people. So a reference case will tell you when there's a new technology, how you should evaluate that new technology. So what are the dimensions of value that you should look at? And it's important to have agreement about these things because that determines what the regulators and the payers will make of this technology and to provide it through the universal coverage system or to discount it so that patients find the technology affordable. So having a reference case can help streamline that process by which the people who are making decisions about whether to provide the technology can decide whether the technology is worthwhile.
I think having a reference case to begin with will help the decision makers realize that there is a lot more similarity than differences when it comes to the economic evaluation of precision medicine versus non-precision medicine. And that's what we are getting at in the reference case, is really providing some clarifying nuances and then providing more clarity about how to deal with the nuances. But these are exceptions rather than the norm. So I believe that having a standardized reference case is going to help the decision makers understand that evaluating precision medicine is not as difficult as they think.
You know, despite the great things that precision medicines can do, it is still not widely implemented in many clinics across the world. Partly because we are scared, and we are also not worried. We are also worried about the cost effectiveness of this new diagnostic tool. So by having this reference case, it allows us to more rapidly and probably in a more standardized manner perform health economics analysis.
Is bringing together the different stakeholders and facilitating a conversation between them, because it can be very difficult for people who are clinically trained to talk to people who have training in health economics and vice versa. So I think what's been really important about this workshop is that it's provide an opportunity for people with different views and different roles within the system to come together to discuss and share and arrive at a common way forward. And I think of all the places in the world where you would have this discussion, for sure Thailand is the best place.